Is a high deductible Medicare supplement plan right for you? A high deductible Medicare supplement can be of great value if you live in the right state, choose the correct insurance company, and understand how the high deductible plan works with Medicare. In this video, I will show you what I do to determine if the high deductible supplements are a reasonable value. But before you can make that determination, you must first know how the high deductible plan works with Medicare. A lot of people misunderstand how the high deductible plan GHD and FHD work, like this guy.
Why don't you address high deductible plan G? Some of the people, maybe stories that you've seen, or we've seen that happen over the years of people who started with that and then kind of had some stuff come up.
Right. Well, anytime they have a high deductible G or a high deductible F, if they were born before January 1st, 55, they have to meet their deductible before Medicare is going to pay anything. So
that makes me feel like saying, if you've already seen one of my videos on how the Medigap plans GHD and FHD work with Medicare, I have a menu system in the show descriptions that you can use to skip to either insurance companies or determining value below. Okay, first, the high deductible Medicare supplement is the only Medigap plan with its own deductible. The other supplements may or may not cover one of the Medicare deductibles, but they don't have their own deductible. Still, a Medicare supplement deductible has no impact on your Medicare. None. It does not create a high deductible for your Medicare. The high deductible is for your supplement only. Medicare is your primary health insurance when you have a supplement, no matter which supplement you have. With the high deductible plan, this Medicare Part A inpatient care and Medicare Part B outpatient and physician services is your only coverage until your out-of-pocket expenditures reach the Medicare supplement deductible. Then you have 100% coverage. When I present a high deductible plan, I find it much easier to understand if we switch some of the terms around. Instead of calling it a high deductible plan, let's refer to it as a maximum out-of-pocket plan. Your insurance is original Medicare Parts A and B until your out-of-pocket expenses reach the amount of the supplement deductible. The supplement plan then pairs with Medicare to give you 100% coverage. Thus, the supplement deductible is also your maximum out-of-pocket for the year. For 2024, that deductible will be $2,800. And in case you're wondering, the benefits of the Plan F high deductible and Plan G high deductible are exactly the same. You have 100% coverage once you have spent the amount of the deductible on inpatient and outpatient services. For example, if you have the high deductible supplement and you see a doctor as an outpatient, you pay the small annual Part B deductible, it's $240 for 2024. Then Medicare pays 80% and you pay 20%. Once you've paid the Medicare deductible, that's the Part B deductible, and you get a $500 outpatient service, Medicare will pay $400, the 80%, and you'll pay $100. To suggest that you don't have any insurance coverage from Medicare until you meet the supplement deductible is simply not correct. It's also worth noting that not every insurance company offers the high deductible Medigap plans. In fact, relatively few do. However, when we evaluate the high deductible plans, your choice of insurance company is critical. Some insurance companies offer plan features that let you change supplement plans without underwriting and/or forgive the deductible completely. That means that with the right insurance company, you eliminate this problem completely.
If they're going to meet the deductible, and then usually people want to get off of them once they get sick.
Yeah.
And now they have a problem because the only way to get off of them is to go through underwriting. And so they are going to be on the high deductible plan the rest of their life.
Of course, you can get stuck in any supplement plan. If so, the worst case scenario is you're stuck in a plan that still provides some of the best health care insurance in the country. Regarding the high deductible plans, one insurance company I work with gives you a 30-day window. On your 2-year anniversary, you can change to any other supplement they have without underwriting. That way you're not stuck. Another company we work with has a very unique and patented high deductible plan where after 2 years on the policy, the deductible disappears. It becomes a regular Plan G with the premium of their high deductible plan. They offer other unique benefits as well. Now that specific plan is not available in every state, but it's a real big seller and in high demand where available, and it's often a great value. Now, if you're interested in one of those, just ask about them when you send us a quote request for Medicare Supplement. Now, for legal reasons, I cannot name the companies in this video. Simply send in a request and we'll talk about them with you. If you wish to find out about these companies, simply submit a quote request as linked above my left shoulder and in the show notes and perhaps the comments below. Hi, I just wanted to take a moment to be sure you're aware of something that you may find helpful. If you're just researching Medicare and trying to figure out which plan is right for you, you may find my free Medicare Mini-course helpful. This is a 4-part course of short videos to help you understand Medicare so that you can make an informed decision. Just head on over to MedigapSeminars.org or click the link above my left shoulder and look for the talking head in the lower right of the screen. When you click on it and choose the free Medicare Mini-course, you'll be glad you did. Oh, and if you like this video so far, please help me out by pressing the like button and feel free to leave a comment or a question. So let's get back to the video. Now that we know how the high deductible Medigap plan works with Medicare and the fact that with the right insurance company you're less stuck than with any other Medicare supplement, let's take a look at how to evaluate the high deductible supplement plans relative to your other choices in order to determine if it's a good value and a good choice for you. First, understand that the high deductible plan is the one Medicare supplement that is most susceptible to inflation. The reason for this is that the amount of the deductible is linked to the Consumer Price Index, the CPIU, and it changes every January. For example, going into 2024, the CPIU was, I think, 3.67%. And so the deductible for 2024 increased by that, rounded to the nearest $10. As a result, 2023's $2,700 deductible became 2024's $2,800 deductible. In addition, like all supplements, the premium can increase as well. This means that in most states you have two features of the high deductible plan that are compounding against you. When the price increases annually, every year you pay more for your policy. When the deductible goes up with inflation, every year you have less insurance coverage. Every year you pay more for less coverage. That can seriously compound against you over the 20 or 25 years you spend on Medicare. This is why I prefer the high deductible supplements in states where they mandate that all supplement plans be priced as either issue age or community rated. In those states, with the right insurance company, you do not have regular price increases. This neuters one of the two variables that are negatively compounding against you. Now, you may still see a price increase, but they are few and far between. With that in mind, to measure the value and risk of a high deductible supplement, you want to compare the annual premium of a high deductible plan to the annual premium of the Plan N. I use the Plan N because it's the lowest cost supplement plan with full coverage. Full coverage meaning you have 100% inpatient and skilled nursing facility coverage. Then we compare that annual cost difference to what you would pay if you end up in a hospital. For example, let's say that your plan GHD is $45 a month and your Plan N is $95 a month. That's a premium difference of $50 a month or $600 a year in premium savings with the GHD. With me so far? So then you end up in the hospital. What happens? If you're an inpatient, you'll pay the $1,632 Part A deductible. That's the Part A deductible for 2024. The amount could be higher depending on what year it is when you watch this video. Now, if you're in the hospital as an outpatient under observation, your costs could actually be higher than as an inpatient because that's when they bill you a la carte. Under observation is the situation where you could end up with an $80 aspirin. A bit of an exaggeration, but you know what I'm talking about. Of course, once you're discharged, you're going to have follow-up visits with your doctor. And again, if you've not paid the Part B deductible, you will then, and then pay 20% for office visits. The bottom line, if you end up in the hospital for any reason, you will very likely have enough out-of-pocket expenses to reach the supplement deductible. Again, for 2024, that's $2,800. But for the sake of easy math, let's say that your hospital stay and follow-up only cost you $2,400 out of your supplement deductible. We showed earlier our example where you save $600 per year in premiums when you choose the High deductible. Depends on where you live, it's just for this example. $2,400 divided by $600 is 4. That means in this example, your one trip to the hospital just cost you 4 years in premium savings. 4 years. If you had a Plan N, you would not have had any of those expenses. In my opinion, if you can destroy 3 or 4 years of premium savings with one unforeseen medical event, then a high deductible plan is not a good value. It's more like a gamble. Now, there are places in this country where the price differential between a Plan N and the High deductible is even less, making the high deductible a worse value relative to full coverage. And in that case, you really should consider the Plan N. But there are also places in this country, Miami, New York, Connecticut, and others, where the Plan N costs $1,600 to $1,800 a year more than the high deductible, making the high deductible a great value. All right, so we all know that value, like beauty, is in the eye of the beholder. But what I've just outlined for you is a method that you can use to help you make that determination for yourself. Is the high deductible plan a good value that will save you money over your lifetime? Or are you taking on more risk in losing your premium savings to one unexpected health event? Our philosophy is that although we may express our opinion on certain Medicare plans, and we will certainly give our advice when asked, at the end of the day, this is your health care plan. It's not our health care. Our role is to guide and advise you, providing you all the information you need in order to make an informed decision. So there it is. Now it's your turn. I make these videos for you to help you make an informed decision. And I hope you found that this information helpful. And I hope, please, that you've pressed the like button on this video and given it a thumbs up for me. It does help. It helps spread this video more easily throughout YouTube. And please leave me a comment or question below and let me know what part of this video that you found most informative or entertaining. I don't really see these as entertaining, but maybe. So anyway, when you do and you help to spread this video, it helps me and it helps others who are looking for this information as well. And we've got lots more videos coming up, so please do subscribe to my channel. I love it when people have comments, well, what about this or that? And I have like 14 videos on that subject. Just subscribe and you'll be able to more easily find them all. Anyway, I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.